Hello everyone, I'm Dr. RMD, pediatric resident at PGMI Dr. RMD Hospital, New Delhi. So it's been around one and a half month I have not released any video because I had my MD final year exams and it's done now. So after this only I was able to upload video, and then I realized that INICET is on the way. So I came up with this INICET November 2025 last 7 days revision strategy because there was so much demand in the comment sections and in Telegram channel telling that you guys need a video for last 7 days. Okay, so let's see what is the last 7 day strategy for INICET 2025 specifically. Okay, so what is different in INICET November 2025 compared to rest of the INICETs? First thing is there is no extra competition. And what do I mean by extra competition? Extra competition means those who gave neetpg 2025, the same people will be giving INICET November 2025 also. Okay, there will be no new batch of students will be coming. Okay, there will be no new group of students. That's why the competition remains the same. Those who have got better ranks in neetpg 2025 will not be performing very well in INICET. Okay, may or may not. Okay, so your chance of getting a rank is always higher in INICET 2025 November. Okay, second thing, neetpg counseling schedule has come yesterday, in which first round gets over by 8th of November and INICET is on 9th of November. So because of this thing, there might be a situation where students might give up an INICET altogether and go ahead with neetpg counseling. That's why again competition will decrease. Okay, third, when you see last year's INICET May 2025 and this year's neetpg, you see that there is lot of overlapping questions between INICET and neetpg. So that's why in my last 3 videos I have repeatedly told that you should be going through PYTs of INICET and neetpg. So these both combined will be asked in the upcoming INICET definitely. There is no doubts regarding it. So that's why PYTs have been a new PYTs. Okay, they are previous year topics and not just questions. Okay, they are the actually deciding factor for upcoming INICET. And who will win in this INICET? Because everyone does has done first phase of preparation. Everyone has gone through 2-3 revisions. The one who has done multiple revisions and the one who has a strong base in PYTs, they are going to crack this INICET. Okay, so why are these last 7 days important? Say November 1 till November 6. These 6 days, I'll give you the timetable in detail, what all you should study in these 6 days. These 6 days are the most important for preparation because in these 6 days, you'll be going through those topics which are difficult to memorize, which are straightforward. Because in INICET, if you watch closely, examiners will ask same questions repeated every year. Okay, same type of questions. They're not like very different clinical case scenarios and all. Most of them are like direct one-liners. And if you see, same one-liners will be there in the explanation part of many of the MCQs from this previous year topics. So that's why these specific topics are the ones that you need to revise again and again. And this is the reason why first aid is one of the best source for revision. Okay, those who have not used first aid, I'll tell you what are the other possibilities, what are the other alternatives that you can use. And that's why first aid still remains the first preference. That is because first aid has so much of repeated topics, lists and tables. Okay, I have made an alternative for that. I'll tell you at the end of the video. So revision is not preparation. That's why you have to revise wisely and you have to revise perfectly, so that for INICET there shouldn't be any problem. Okay, so this will be your schedule for next 6 days. Okay, that is from November 1 to November 6, and along with that November 7 and 8 what you have to do I'll tell you. Okay, so November 1 you will start with this subject in this specific order only. I have thought about this and I have come up with this because there is a particular sequence in this. For example, these are the main subjects, okay, from where majority of the questions are asked. Okay, OBG, medicine, patho, pharmac, okay, micro. So these I have given maximum time in these 6 days for this final revision. And less important topics like anatomy, pediatrics, ophthal, okay, physiology, PSM, they have some other they have around 3 to 4 hours per day. Okay, and the last are the minor subjects which you have to dedicate only 1.5 hours. Okay, 2.5 hours. So these are the topic list that you should go ahead, and I have also given time like what you have to go ahead. And what about specific topics, I'll tell you. Okay, See, for where you have to revise all these topics, if you have a revision source, that is the best source for revision, no doubt in that. Okay, if you have made a consolidated revision source, that is good. But from my conversation with students in so many like social media, what I realize is students don't have a final revision source for preparation. So in last 6 days or last 7 days, you have no idea where you are going to prepare from. That's why I have made this list. Take a screenshot of this, like for example pathology from revision, rapid revision, or first aid, FA is first aid, and image bank. So I have given all this. Okay, take a screenshot of this. If you want to go through your coaching notes or whatever notes you have made and you just want to revise, you can use this and integrate it with this timetable. Okay, but for what about those students who don't have a particular source to revise, and those who have not made any plans for revision? For them, I have come up with a separate source, that is a checklist. Now, what is a checklist? A checklist is a document that contains all essential information before you attempt an exam, which means that make sure that you have gone through all specific topics before going to INICET. Similarly, like you might have realized, like anesthesia, there is a checklist before you put a patient into sedation. Similarly, a pilot has a checklist before plane takes off. Similarly, before you give exam, you should have a checklist where you can actually mark things whichever you have completed, so that you can be sure that you are not leaving anything important. Okay, so I had released a neetpg checklist for last neetpg, and that had got so many positive reviews. Okay, so I was like overwhelmed. I didn't think that people are so much into this checklist kind of thing. That was a last minute plan, and there were many flaws in that also. So this time I have come up with the newer edition of it for INICET only. Okay, INICET checklist, where we have rectified all the mistakes which we had done last time, and this has very crisp and very concise version, and there are no mistakes this time. Okay, so this is the INI checklist. We have named it as Gold Edition. Okay, Gold Edition for November INICET 2025. So to give an example, okay, this contains all subject wise list of topics which are to be revised before INICET in that last 7 days. For example, let's say surgery. In surgery, this is the order you should follow. So first you will get all the order of the topics which are to be followed in that specific list only. Okay, and then you will be going through each specific topic, and each specific topic questions are chosen based on how many times it has been asked, which means achalasia cardia has been asked many times in INICET, acute pancreatitis, ERCP, MRCP, foreign body, GIT. Okay, so list goes like this. Whipple's procedures is the least asked. Okay, so this is most common to less common questions. And after that comes second is trauma. Trauma is repeatedly asked question, and all these trauma things you should know. General surgery, this is the most common to least common. Urology, this is the most common to least common. Breast, endocrine surgery, spleen, pancreatic, so all this. So what I want you to do is, let's say on November 1 you are starting with surgery. This is the schedule that you have to follow in last 7 days. So first you will go through surgery. You will have 3 hours. In this in 3 sessions. Okay, in these 3 sessions you should divide it with whatever checklist that I have provided. Okay, for example, in first hour you will be completing GIT surgery and trauma. In second session you will be completing general surgery, surgery, urology and breast, and in third last hour you will be completing the rest of the topics. So there is something to keep you in check, that is within like 1:30. So this is not PM, AM, this is PM. Okay, within 1:30 PM on November 1 you will be done with all these important topics, so that you don't have to worry about leaving out any topics before INICET exam. Okay, similarly there are all these subjects, so you can go through all the topics from your subject. You can use, best thing is revision source. Whatever you have revised so far, you can use that as a reference to study extra things. Okay, so then there was a problem that in INICET always pre and paraclinicals are the most important topic, that is anatomy, physiology, biochemistry, pathology, pharmacology and microbiology. So many people had asked me that if you have not read first aid and you can't read now at last moment, so is there any alternative for this? So I was thinking about it and I came up with the idea. So for this INICET November 2025, I have come up with a PDF. Okay, so where we have just pre and paraclinical memory tables only. Okay, there are total around 150 memory tables which you will have to read along with this study timetable. Okay, so for example, when you go across biochemistry, you will go through this PDF. Okay, let's say, like for example, pathology. Okay, so here you have all crisp information in this single table, like ALL versus AML. What are the important points you need to know? Like for example, in APML, you should know it is translocation 15 to 17. You should know coagulopathy is an important hallmark. Differential diagnosis, DIC and sepsis. So these will be your different options in the MCQ question. And treatment is ETRA. And what you will have to remember, these are some of the memory things that you can use. Okay, like promyelocyte is the main the cell that is involved in APML. Similarly, let's say for and you see the reference is actually from Harrison. Okay, so we have given everything, all references for this. Similarly, let's say Neisseria, gonorrhea and meningitis, again a repeating topic in INICET. So what is the their microbiological profile, and what are the different symptoms that are caused, how to differentiate it, okay, how to differentiate meningitis versus gonorrhea, what is the treatment. So everything is given concise. These are only for these 6 subjects, the 6 preclinical and paraclinical subjects, because these have highest weightage in INICET, and because you don't have any other source where you can combine everything, that's why I had come up with this idea. Okay, similarly, you see in microbiology, difference between various herpes viruses, like how will you differentiate between CME, how will you differentiate between EBV, how will you differentiate between varicella, and what are the main cytological features. Like for example, here you'll see owl's eye inclusion in CMV. Similarly, EBV is more commonly seen in Burkitt's, Hodgkin's. It is known to cause those things. Okay, so this is like a rapid last 2 days revision type of kind of thing. Okay, so these 2 PDFs, if you haven't properly revised anything and if you don't have any revision source, I highly recommend it, because after neetpg was done, and then when students came out and then they started texting me like neetpg this Juxtamed checklist, okay, neetpg checklist that we had released, it was very useful for them. Like most of the questions were repeated from that only. That's why I came up with this idea again. So those who don't have a proper revision source, you can go ahead with this. So link is given in the description and the comment section of the video. Also the link for this PDFs will be shared in the Telegram, WhatsApp and Instagram channels. Okay, and if you have any doubts regarding this to both PDF, you can text me or email me on email ID okay, I'll just mention the email ID here, babydocrmd@gmail.com. okay, so there is a warning specifically. Even last time also we had issued a warning. There is copyright on this PDFs. Okay, both the PDFs. So for both the PDFs, you can't do all these things. Okay, so you will have to face punishment. Okay, so what are the last minute precautions that you need to take before INICET 2025? One is reach exam center 1 day prior. It is very important. Then avoid motion sickness, because your centers will be far away only. Next, don't give GT in last 1 week. That is most mandatory. Only focus on revision. Nothing else. Either revise from first state or revise from your specific revision book if you already have, or if you don't have both of these and you want some revision source, revise from this INICET checklist, and along with that from pre-paraclinical memory tables. Okay, so these 2 PDFs you can avail. Okay, link is in the description. Okay, so finally I want to just conclude telling that our goals can only be reached through planning. Okay, so whatever you do in last 1 week, whatever planning you do, that will reflect in your INICET rank. It is nothing regarding whatever you studied earlier. So even if a topper like who has got less than 100 rank in neetpg, even if he studies if he stops studying in last 1 week or 10 days, he won't be able to crack INICET, because INICET is do or die. Either you give everything or you're not, and INICET requires your utmost preparation and revision even till last day of exam. It's not like you leave revision at last moment for INICET. No, for neetpg the story is different, because there the type of question that are asked is totally different from what is asked in INICET. INICET is more of memorization. It is more of repeating core topics again and again. neetpg is more of clinical, and it is more of applied type of questions. Okay, so for INICET, revision is the most important phase. So don't waste this 7 days of revision. Properly implement this, and then you will be coming out in flying colors. So all the best for INICET. We'll meet after INICET again.